Perfect. Perfect. Dr. Debashis Das, welcome to this author talk show. This is Nitin Soni. You know me already, and I give you a very warm welcome. Thank you very much for accepting the invitation and joining us today, sir. Thank you very much.
Welcome. Thank you so much for calling me today.
Yeah, thank you very much. Well, so we are live now on YouTube, and I'm sure as we discuss, as we move along, we will be seeing a lot of our friends joining in. And as and when people join in, they will be having some questions, which I will take on their behalf.
Absolutely.
Well, Dr. Debashis, do you want to talk a little bit about yourself? What do you do? Where are you based out of? Just tell us something about you, please.
Basically, I was in Chennai. I did my post-graduation at Shankar Nethralaya in Chennai. I was there 5 years, and from 1993 to 1998. And thereafter, I returned back to Calcutta. Calcutta is where I did my schooling. I returned back to Calcutta, and I had set up my ophthalmic unit. I'm an eye surgeon, ophthalmic unit in Calcutta. So presently, I am in Calcutta. I'm practicing in Calcutta. I'm into ophthalmology, basically vitreoretinal surgery, and my specialty is in uveitis, which is a super specialty in ophthalmology.
Perfect. And you're currently based in Kolkata?
I'm currently based in Calcutta, yes.
You're based in Calcutta. Perfect. And how's, I'm sure this, ever since this pandemic has happened, this COVID thing has happened, and especially now when this new thing that we are hearing probably for the first time, at least as a layman, as a doctor, you must be hearing that. You must have heard of it before. But ever since this new, thing has come up named black fungus, people say it has been there ever since. It's just that we are becoming conscious of it now more. So I'm sure you've been keeping a little occupied these days, a little more than
earlier. Absolutely. The scenario has changed. Particularly, this black fungus, what mucormycosis, what we say, has been there earlier also. But the thing is, mucormycosis usually infects the patients who are very debilitated, whose immune system has gone down. But now, with the COVID strain, the second strain, in the second wave, our immunity system is down, particularly, which was not there in the first one. So with the immunity system going down, this fungus is taking an upper hand, which was not there previously. So the number of cases has shot up like anything. We have till now in West Bengal, we have seen around 12 fatalities.
I see. So as a doctor, how easy or how difficult is it whenever something new comes up? I'm sure it's not easy. I mean, of course, it's not easy for people who are suffering from it. But I believe somebody who is a doctor who is treating a patient, how easy or difficult it is for doctors like you.
It is not only difficult; it's extremely painful. It's extremely painful in two senses. First of all, sometimes we lose our wits. Next, we fail to say what shall we do next? What can be done further to prevent this further spread of this disease? And black fungus, it spreads within 24 hours. If it is not treated right now, you are gone. The patient succumbs to death. And that is the main problem of this situation. You have to treat right away. You have to diagnose within 10 minutes. You have to come to a diagnosis and start your treatment. You cannot wait for culture and sensitivity. Culture takes 6 weeks. By that time, the patient will be no more. So you send for culture, but you start the treatment immediately within minutes.
That is,
that is mind-boggling.
It's absolutely mind-boggling.
And those who are working in this mucor ward, we have a West Bengal government has started one mucor department at SSKM hospitals, particularly for these cases. If you be there, you have to be on your toes throughout.
Absolutely. I completely agree. So is it like the COVID patients are the ones who are more prone to, getting this black fungus?
At present, with this COVID second strain, yes, not the first strain. In the first wave, we have not seen so many cases, mind you. Only the second strain is showing this black fungus infections secondarily after the COVID has happened. In one case, there's a girl, she developed COVID after 3 months. She developed mucor after 3 months of getting better with the COVID. She went home, and then after 3 months, she got this black fungus. So after the COVID is over, the precautions should be continued in the form of masks, sanitizers, all those things.
Makes
We
sense.
we should not give a lackadaisical approach at any point of time, at least in this current stage.
Is there a way to avoid it? Is there a way, like for somebody whose immunity is down, somebody who has had COVID, let's say, and because what we are reading in the news is that, once somebody is COVID positive and then he recovers from COVID, immunity is down. That is the point when they are generally developing the symptoms of this disease.
You are 100% correct.
So then, is there a way for these people who are in the recovery stage, or people who are recovering or recovered, to be able to kind of negate or avoid this thing to happen? Is there a way?
There are two aspects into it. See, the people who are in the ICU, people who are in the ventilators, and these ICU and ventilators are continuing for weeks together, 3 weeks, 4 weeks, 5 weeks, 6 weeks. The basic prevention is we have to change the humidifiers, we have to change the nasal tubes which is going in, we have to change those precautions in the ICU, in the ventilator systems, which will be taken care of ourselves. That is our role. And what is the role of the common man on the road who has just suffered from COVID? For them, there's another option. Their option is follow hygiene very meticulously. Don't reuse your masks. You get your masks, either new one, or you clean it, and then reuse it, because the fungus tends to develop in the moist. The inner part of the mask is moist because of your inhalations, exhalations. It is not dry. So, and we have a tropical climate. So the fungus keeps growing within those networks of the meshes. And if we reuse the mask the next day and the next day, what happens? Funguses develops there. If you keep a bread, there will be a black fungus over it in the rainy seasons, if you have noted properly. So this is the same black fungus, the mucorales, which develops on the masks and goes through the nose, through the mouth, into our system. In the general man, okay, the mucorales are there now, even in your room, even in my room. But we are able to resist it because of our immune system. We are inhaling it, but we are able to resist it. Our immune system is resisting it. But in case of individuals who have undergone COVID, their immune system is down, wrecked havoc because of this COVID virus. The COVID virus has put their immune systems down. For them, there should be double masking, one cloth mask and one N95 masks. They should wash their hands properly with soap and water regularly, sanitize their hands. Everything in their house should be neat and clean and tidy. It should be kept, there should not be any dirty things around, because dirty linens, moist surfaces tends to develop the fungus very fast.
Makes sense. So primarily what we are saying is hygiene. It has to be hygiene. The key is hygiene.
The key is hygiene, both at the level of the house where the patients are residing after COVID, and at the level of the ICU and the ventilator systems where we are working, because these patients are also prone. So we have to take care of these patients in the ICU. We are taking care of these patients in the ICU, and still there are cases, mind you, and still there are cases.
This is, I mean, I can only imagine, being a doctor and somebody who is, how long have you been practicing? I'm just curious to know.
I'm practicing since 97.
Since 97, right? So you must have. So when this, I want to take you back in time when this COVID thing happened, and all of a sudden, I mean, it didn't give anybody any chance to, prepare for it in the first go. So how was this, your reaction, I would say, or the medical fraternity's reaction when this, when this thing suddenly happened last year, and when we, the lockdown was announced? What went through your mind, and what went through the minds of the people who are in the medical fraternity about this new, this outbreak of COVID? I just want to take you back in time. And what was the initial thoughts like?
See, in the initial stages of the first wave, actually, we were not totally aware of the situation, how it will spread. Initially, we should remember that we stressed a lot on the fomite transmission. That means somebody touching the doorknob, and we are touching it again, and the virus comes through that doorknob into our hands and to our nose. It is not that. Now we are aware that it doesn't spread through fomites. It is spreading only as aerosols or particles airborne from one nose to another nose. So basically, our understanding has improved over time. Initially, we were in the dark, how it is spreading, how fast it is spreading, how virulent it is. All we knew was the study journals from US, which started earlier to India, and the study journals from China, where it has originated. But as far as India is concerned, we were in the dark. But gradually, with time, with the passage of time, the understanding and the spread, how it is spreading, what are the problems it is initiating, we came to know of all these things. But at the initial stages, our experience is very traumatic. The supplies of these personal protective equipments were grossly poor. You know, in West Bengal, they were given raincoats instead of these PPE kits.
PPE kits.
Wow. So it is that bad. And there was acute shortage of N95 masks at that stage. And there were acute black marketing of these N95 at that stage. Even doctors, we failed to get N95 masks, and we worked with only cloth masks and these ordinary surgical masks during this stage. And to tell you very frankly, we lost quite a good number of our friends in this COVID. Even my batchmate, we studied together in medical college. He passed away in the first wave, and thereafter in the second wave, a few more of our friends passed away. 594 deaths in this only second wave in 2021 till date recorded. So things are really grave for us who are working in the forefront. But I hope we have a better understanding at this stage of the disease, and we know how to prevent at this stage of the disease. We know how to treat. See, initially there was a thought that ventilation of the lungs would improve the patient. Now we are finding there is coagulation in the blood vessels, and only ventilation will not work. Initially, there was a thought to pump in more steroids. Now we felt steroids should be used at the later stages if the patient is deteriorating. So, you know, we are learning every day. Nobody knows the perfect full picture of the situation. And the more point is the virus itself is mutating. The virus which was there in the first wave in India is not as virulent as the virus it is today in the second wave. The virus in the second wave is a different strain. It's a double mutant strain, which is presently circulating in India. This is more virulent, both in the terms of spreading it and in the terms of causing immune status debilitation. So it is both way wreaking havoc. But the thing is, we are understanding the situation. We are trying to cope with the situation, even if there are losses amongst ourselves, but still we hope for the best. There is a prediction both by the WHO and by the government of India that the third wave is coming in. And already, as I am studying in the journals, third wave has started in UK. And they predicted the third wave will predominantly affect the children. So basically, and this will come down in October or November, around that stage. So, but presently the second wave is gradually improving. You must be noting the number of cases are coming down. The number of deaths per day are coming down. So we are thinking positive. We have to come out of it. We don't have any other choice.
Absolutely. So, I mean, is it like now with people can with absolute certainty agreeing to this, that they should be prepared for another such wave?
See, these predictions, I do not know how much they are authentic, though it has been acknowledged by WHO and the government of India. But sometimes what happens, the predictions don't come. It's like a weather forecasting. We forecast a thunderstorm and the thunderstorm is not there. So it cannot be 100%. So it is very difficult to comment on these issues. I can only say there is a prediction by WHO and there is a prediction by the alertness from the government of India, and that much to it as of now.
Fantastic, fantastic. I want to just tell every single one of the participants who have joined us today, I am in talks with none other than Dr. Debashis Das from Kolkata. He's an eye specialist, and the discussion is around black fungus. The discussion is around COVID. And in case you have any questions that you want to ask the doctor himself, please feel free to put it in the chat box and we will take your questions right away. So doctor, what is it? Is it something to be worried about? Like as a layman, let's say if if somebody had COVID about 6 months ago, fully recovered, leading his life normally. Let's say somebody like me. So I tested COVID positive last year in about October. Now, ever since, everything is fine now. I'm back to my normal life. Everything is good. Is there something to be worried about people like us, or is there something to be worried about for people who are who have not yet caught COVID and about this black fungus stuff? Is there something to be worried about, or is it something not to be worried about as much as it has been hyped? I just want to know your thoughts on this.
Not to be worried about. It is much hyped.
It is much hyped. Yeah.
Yeah. But the basic thing which you who had a COVID infection 6 months ago, the basic thing is maintain your COVID protocol. Maintain your double mask. Now they are saying it's not a single mask, it's a double mask, of which one is a N95 and the other is a surgical mask or a cloth mask. Anything. Use a double mask in public, number one. Number two is keep your hand washing and sanitization that much. Maintain the distance of 6 meters to 6 feet. And these are the basic things which I had already said during the first wave. And that is the only thing we should follow. Nothing, don't worry. Otherwise,
right.
Don't worry.
Right. And I have another question for you. One of my teammate, now she wear contact lenses, right? Now, very specific question for, on behalf of people who wear those contact lenses during these times, these pandemic times, and when this black fungus is creating havoc there. So is it like, do you recommend not to wear them, or is it okay? I mean, they're still safe.
If you can maintain your hygiene, you are safe. Most of the situations, the people who use contact lenses do not change their contact lens solutions every day. They do not wash their hands with soap and water for 20 seconds at least before putting on the contact lenses and while taking off the contact lenses. So as a routine coverage, we say, don't use contact lenses in these COVID times. But somebody asking me on a personal note, if he or she can maintain their hygiene properly, the opening, the picking out, the putting in, the changing of the solutions, and washing of your hands, you're fine. Go ahead.
I see. Okay. And let's say a family who has a COVID patient or somebody who has recently recovered, whose immunity is down. Is it that somehow other people might eventually, be affected in the family as far as this black fungus is concerned?
Not necessarily. Not
necessarily, right?
Not necessarily.
Not necessarily at all.
No,
right. Makes sense.
Absolutely no.
And what about children? So as we were discussing, the third wave might affect children. So talking about this black fungus and talking about this thing which is happening right now, are kids safe at the moment?
The kids are safe as far as the black fungus is concerned because their immunity status are usually very high. The only thing is we had a few cases having this second wave. During the second wave, they had COVID, but they're recovering very well.
Okay.
What we are apprehensive about the third wave, which is said to be involving the children more. So let us see and watch and see. But as of now, I don't think there is any other more apprehension for the children otherwise.
So basically what we have discussed is that if we maintain hygiene, if we maintain proper hygiene, there is absolutely nothing to be worried about as such, right? If we maintain proper hygiene, that is the basic thing.
And the COVID protocol.
And the COVID protocol. So double masking, as you said.
Double masking, washing your hands, and maintaining safe distance. 6
right.
feet.
Right.
So these three things you just keep in mind, and you will be able, 99% you will not have a COVID.
Fantastic. And is there any recommendation around what to eat, what not to eat, what to wear, what not to wear?
Nothing. It doesn't have any impact on the COVID or the black fungus.
I see. Is there any correlation with dandruff?
No.
Not at all, right?
Not at
because
all.
we sometimes hear this because of this dandruff, some rashes, this issue is there in the eyes.
Exactly. You are 100% correct. The rashes which appears on the eyelashes because of the dandruff, we call this squamous blepharitis. But this is an age-old problem. It has been there since ages, and there is a specific treatment for it. But it is not related with the COVID infections right now going on.
Absolutely, absolutely. So how's this when you by the way, I mean just something to talk about off topic. You are also an author of a book, right? So the book is right there in my hand right now, Dr. Debashis. Am I right, Debashis? That's
Yeah,
your Amazon #1 bestseller, right?
the
So
credit goes to you.
no, not at all, not at all. I mean, I just want to ask you off topic. This separate thing that I want to check with you is, how did this come to you to write a book? I mean, somebody like you keeping busy, patients, family, this medical stuff, and this is like completely different from what you do. What part of you is like into radiances, which says realizations of mindfulness is beyond. I mean, I'm really curious to know, because I
Well,
still remember the day I met you. I literally thought you would be writing something related to eyes. I was convinced it would be a book which is related to medical stuff, but you kind of surprised me and the audience when you showed the different side of Dr. Debashis Das. So please tell us something about that.
actually, I had been writing since my childhood,
I see.
and I had been writing diaries, which were
Okay.
lost in most of the times.
Okay.
And thereafter, from class 8 or 9, I published a Bengali literary magazine,
I see.
my own. We call it Little Magazines in Calcutta.
Hmm.
So these are small, short, thin paper editions.
I see.
And I used to do it until I entered the medical system,
I see.
where I failed to make time for all those things, and I had to quit.
Hmm.
Downline, and thereafter, since 2010, 2008, I again started writing, and these writings are basically, again, I started in English.
Hmm.
And these writings are basically memoirs of each day, almost like maintaining a journal or a diary, personal diary, which most of us usually do. And these are basically what I started as a philosophical thought throughout the day. At the end of the day, after we had a family dinner together, then I used to recluse back to my room with a pen and a diary, and I write the whole day's whatever went on throughout the day, and what is my philosophical input out of that day. Any specific incidents, any specific words from anyone. It may be my patients, it may be my wife, it may be my son, it may be anybody, my father, whoever. And I usually pick up the philosophy behind what they talk, and the philosophy I find how I react to these situations. And then I later realized this is basically very small mindful incidences, which could be compiled in a book format, and that has been collected since 2010. And incidentally, then it is my good luck that I met you, and you only encouraged me to publish this book. Otherwise, I never thought of publications whenever I wrote these stories.
I consider myself lucky there. And why we are discussing this, Dr. Debashis, one of our friends who joined us, Rita Mathur, she wishes to know, is there a possibility for someone to get COVID infected, even in spite of getting vaccinated once or taking both the doses?
Yes, definitely yes. We should remember, again, I should say, the COVID-1, the vaccines are from the COVID-1 virus, which we had in the first wave. In the second wave, we are having a double mutant strain, which is different from the virus which infected us earlier. So this double mutant strain is more infectious and more harmful than the strain of which the vaccines are made. So if you are not careful with your COVID protocol, you are likely to have your second infection once more.
But it wouldn't be as life-threatening, I would say,
we had deaths. We had deaths also. Even after vaccination, there was infection, and we couldn't survive the patient.
Makes sense. Makes sense.
So it is as bad. We should not take anything lightly at this stage, at least. They say this is our understanding, and our thoughts changes almost every day. Whatever
Absolutely.
I'm saying today, perhaps 6 months down the line, if I again have a show with you, perhaps I'll be talking different. So science gradually changes over time with the experience.
Absolutely.
With the research protocols. As of now, maintain your COVID protocol and you will be safe. Don't think that once you are vaccinated, you are safe. Even once you are infected, you are safe. You are not safe because the virus is mutating itself. It's not the same virus, but it is the same you.
And is it like the things that we buy, the things that come in our house from outside, including the eatables or vegetables or fruits or anything that we buy from outside, or anything that we buy, let's say we order something, let's say we order a book for that matter, is it like, again, there's some chance of the of getting COVID from that?
Exactly, that was what I was telling a little earlier. So usually in the first wave, they thought that it is transferred by fomites. Fomites means, say you are touching the doorknob and the COVID infected patient touches the doorknob and then you go and touch the doorknob. So the virus transforms from his hands to the doorknob and to your hand. It doesn't happen that way. So the vegetable materials, whichever is coming from the market, initially in the first wave, we all washed and cleaned and sanitized them before we put them in the kitchen. Same thing with the books, which was delivered by Adhyan Books. So we sanitized them and did everything. But these are not the actual spreaders. The actual spreaders are directly spread. Virus spreads through air, it's airborne and aerosols. That means airborne light water particles along with these virus spreads from nose and mouth of one infected individual to the nose and mouth of a new patient. So
that is
how it
very
spreads.
important information that you have.
Absolutely. It doesn't spread through other contaminants.
This is a very important piece of information.
If you recall, we highlighted, all the medical systems highlighted not to touch there, not to go there. But now in the second wave, no such talk is there in the market.
True.
Nobody is saying about it.
True.
Because we realize it's not valid.
Absolutely. Well, there are a few more questions coming in. Rita Mathur has expressed her gratitude to you for answering her question. There's another question that has come up from Razin Thapi, and the question is, sir, we have been also hearing about white fungus along with black fungus, and there was I mean, as you know, I was reading a message the other day. It said, what's the plan, like, guys, are you going to play holy with us, like black and white and yellow, and there's so many? So I'm just this is funny, but on a serious note, I mean, is that true?
It is true. There are white. Actually, there are thousands and thousands of fungus, and each has its own color once they grow. There is the black color, there is a yellow color, there is a white color, there are pinkish fungus. So basically, it all depends on which genera the fungus is from, but that doesn't alter the pathology. Usually, the black fungus is what we are talking about right now. The other colors usually do not involve the human beings.
I see. And Dr.
They
Debashis,
are there.
They are there, right? And Dr. Debashis, how would somebody come to know? When would this realization come that this is black fungus and I need medical assistance?
There is severe excruciating pain in your eyes or your nose wherever the black fungus is growing. And it is so much painful that no painkillers will be able to put it down. And you have to rush to anybody, either an eye surgeon or an ENT surgeon, because the pain and there is a bad odor, there is a bad smell because of this black fungus. And these black excruciating pain and the bad odor is a very telltale sign that you are having a black fungus. But it is black fungus is not common so far in the normal patients. So I don't think you need to worry about those who have not having COVID.
Makes sense. There's another question which is coming up from Shruti Pradhan. The couple of questions are away now. Well, Shruti is keen to know, and I also, by the way, heard it. So you need to, either you need to break this myth or say that this is true. And the question is, I read somewhere that black fungus develops inside fridge or some places in home also. Is that true?
Any moist surface will grow the fungus, be it black, yellow, or white. Any moist surface, you keep a bread moist on your table and watch it after 2 days, you will get the color of the fungus, whatever is growing over there. But don't worry about them. Your immune system is as good to hold any disease from them.
So the bottom line is immunity. I mean, in this entire discussion, and ever since this COVID has happened, I think the bottom line is immunity.
Absolutely.
Any suggestions?
And the hygiene.
And the hygiene, absolutely. Very important. So I guess these are the two important words: immunity, hygiene, and COVID protocol. Protocol, right? There's three things that we have primarily discussed. Pretty good. Any suggestions or any comments on immunity? I mean, anything that you want to say? Is it a way to, boost it? Is it a way to know that our immunity is fine? I mean, is there anything that you want to talk about that? Immunity.
The basic ingredients, the spices we have in our Indian foods, that improves our immunity, our immune status. The basic normal food, home cooked, whatever we have, the vegetables, the dal, the chapatis, the rice, whatever. And that is enough for our immunity. You don't need to buy those costly medicines in the market. Those are more of marketing than anything else.
So you are suggesting no need to take those multivitamins every night and those vitamin C's every night?
No, those are a wastage.
Not required at all.
Not required at all.
Wow. That is interesting.
No. Let me be very frank. See, these ingredients are all there in your daily food.
True.
These has come up over the last 50 years. Before that, what our forefathers did, they were never suffered for any nutrition deficiency. They had the normal homemade normal food.
True.
So I think the rest of it is marketing, absolute marketing. Don't go for it.
Makes complete sense.
Normal seasonal vegetables, seasonal whatever is available around the area. Don't go for packed foods. Don't go for processed foods. Normal vegetables, dal, roti, sabji, whatever you have in your home, have it. Your immunity is high.
And it has nothing to do with veg or non-veg. No one is
nothing to do with veg and non-veg.
Absolutely. Good enough. Good enough. Really. I mean, I think this has been a very insightful discussion that I had with you, Dr. Debashis. You have literally, helped us get over some of the myths, the most important being the touch stuff. So the chances of getting COVID is not there when you touch those surfaces. It's basically airborne. So keep social distancing, wear proper masks, and
wash your hands.
Wash your hands. Hygiene has to be there. For black fungus, for white fungus, all of this, you have again mentioned hygiene is the key. Immunity is the key. So eat healthy, eat fresh, and take proper sleep, right? So do your normal stuff. If you are keeping indoors, do your yoga and pranayama, whatever it is that you do, and just be happy, right?
Absolutely. Happiness is a big factor.
I guess that's the bottom line. In case you are staying at home, and if you're wondering what to do, then here is a book that I wish to recommend to my audience right now. They can grab a copy of the book from Amazon and read it, because this book was written by none other than Debashis Das himself. Pretty interesting book, Perspectives of Life. You would love reading it. Dr. Debashis, it was a pleasure talking to you. Thank you very much for sparing your time and doing this discussion. I not even realized that we've been together for almost 40-45 minutes now. On this behalf of the entire community, people who joined us, I really want to thank you from the bottom of my heart, and look forward to have more discussions with you on different aspects about health, about life, and whatnot. So thank you very much. It was a pleasure connecting with you, sir.
Rather, I would thank you for having me on your platform. I'm really indebted to you, sir. Thank you so much.
Thank you very much, Dr. Debashis. I'll see you soon then. Bye now.